Okay guys, so this week we're going to talk about the reproductive systems. You remember I said way back at the beginning that some places separate them and call it two different systems of male reproductive and female. We're considering it all just the reproductive system. We're going to talk about both of them this week. So the reproductive organs, the primary sex organs are the ones that produce and house the sex cells. And then the secondary sex organs are the ones that provide the route by which the sex cells unite. So the primary sex organs are also called gonads. In men, these are the testes. And in females, these are the ovaries. The gonads produce sex cells called gametes. In men, it's called sperm. And in females, it's called eggs or ova. The secondary sex organs encompass any other organ that's necessary for reproduction. In men, this is a system of ducts and glands, and the penis, and they're all charged with storing and transporting sperm. In women, the secondary sex organs provide a location for uniting of egg and sperm, as well as the environment for nourishing a fertilized egg. So the male reproductive system serves to produce, transport, and introduce mature sperm into the female reproductive tract. The testes, the penis, and the scrotum are the external portions of the male reproductive system, and inside the scrotum are two testes, one on each side. These are the organs that manufacture the sperm and produce the male hormone testosterone. Extending from the abdomen to each testicle is a strand of connective tissue called the spermatic cord. Inside this spermatic cord is where the sperm duct is. It's also known as the vas deferens. And then there's also blood vessels, lymph vessels, and nerves within this cord. The two small oval-shaped testes lie suspended in a sac of tissue called the scrotum. And there's a median septum. Remember, median is the middle. The septum that divides the scrotum. The cremaster muscle surrounds the spermatic cord and the testes. This is what, in cold temperatures, this will contract to draw the testes closer to the body for warmth, because the testes can't be as warm as your internal temperature, but they can't be too cold. Inside the testes, there's a series of spermatic ducts. You can see them all. It's right here. All of these are considered part of the spermatic ducts. These carry sperm away from the testes and out of the body. Each testes is divided into over 200 lobules by some fibrous tissue. Inside each lobule are 1 to 3 seminiferous tubules, and this is where sperm are produced. There's several layers of cells that line the walls of the tubules, and inside each layer is sperm in a different stage of development. And we're going to talk about those stages in a few minutes. Also in the wall of the tubule are cylindrical cells called Sertoli cells. These cells promote the development of sperm by supplying nutrients, removing waste, and secreting the hormone inhibin, which plays a role in the maturation and release of sperm. Lying between the seminiferous tubules are clusters of interstitial cells called Leydig cells, and it's Leydig. These are the cells that produce testosterone. There's a network of vessels called the rete testes, that's R-E-T-E, right here. Looks kind of like Swiss cheese, doesn't it? These lead away from the seminiferous tubules, and these provide a location in which the sperm can partially mature. Efferent ductules conduct the immature sperm away from the testes to the epididymis. You're going to notice the epididymis is outside of the testes, but still inside the scrotum. Sperm move from the head of the epididymis to the tail and mature as they move along. Then they're stored in the tail of the epididymis, where they can remain fertile for 40 to 60 days. After that, if they're not ejaculated, they disintegrate and they're reabsorbed by the epididymis. Sperm leave the tail of the epididymis and pass into the vas deferens. The vas deferens then travels up through the spermatic cord into the pelvic cavity. You can see it right here. Over the ureter, so it's all the way up here, over the ureter, this is the ureter, to the prostate behind the bladder. As it turns downward, it joins the seminal vesicle to form the ejaculatory duct. And there's two ejaculatory ducts, one for each testes. These ducts pass through the prostate and empty into the urethra. So you can see these right here. And this is the prostate gland, and they empty into the urethra. And this also is the prostate gland because that surrounds the urethra. At the base of the bladder, these seminal vesicles, one for each vas deferens and each testis, and secrete a thick yellowish fluid into the ejaculatory duct. This fluid comprises about 60% of the semen. It contains fructose, which is used as an energy source for sperm motility, and some other substances that nourish and ensure the sperm motility. The prostate gland encircles both the urethra and the ejaculatory duct. Remember, I just said that. Here's the prostate gland right here surrounding this urethra. And when you get to med-surg and the GU system, you're going to learn about how that can cause problems if that gland gets enlarged. The prostate also secretes a fluid. It's a thin, milky, alkaline fluid into the urethra. It adds volume to the semen, and that makes up about 30% of the fluid portion of the semen. And it also enhances sperm motility. There are two tiny pea-shaped glands right here. You can see them, called bulbourethral glands. An easier name is Cowper's gland. These secrete a clear fluid into the penile portion of the urethra during sexual arousal. That fluid acts as a lubricant for intercourse, but it also neutralizes the acidity of any urine in the urethra because too much acid is going to harm the sperm. Remember, the fluid secreted by the prostate gland is an alkaline fluid to help the sperm motility. The penis itself, the body of it is called the shaft. The head is called the glans penis, and there's a loose skin covering it that's called the prepuce. I don't know if I'm pronouncing it right, but that's how I'm choosing to pronounce it. Inside the penis, there's 3 cylinders of erectile tissue. During sexual arousal, these cylinders fill with blood, which causes the penis to enlarge and become erect. The 2 larger ones are called the corpus cavernosa, and the smaller one, called the corpus spongiosum, also encircles the urethra. Spermatogenesis, I know I said I would talk about the production of sperm and the maturation of sperm. Sperm begin as spermatogonia. These are primitive sex cells. They're located in the walls of the seminiferous tubules. I just talked about that too. These divide by mitosis to produce 2 daughter cells, each with 46 chromosomes. These cells then differentiate into slightly larger cells called primary spermatocytes, and these move toward the lumen of the seminiferous tubule. Through meiosis, and the sex cells are the only thing that undergo meiosis, otherwise cell division is always mitosis in people. I think we probably talked about that way back in the beginning. But through meiosis, the primary spermatocyte divides into 2 genetically unique secondary spermatocytes, each with 23 chromosomes. Each secondary spermatocyte divides again to form 2 spermatids, and then the spermatids differentiate to form heads and tails and eventually transform into mature spermatozoa or sperm, and each of them have 23 chromosomes. The sperm itself, of course, has different parts. The head of the sperm, right here, that's where the nucleus of the sperm is. That's where those 23 chromosomes are located. The middle piece, right here, has the mitochondria. And you remember when we did cells, the mitochondria are like the powerhouses of the cell. They produce the energy. That's what gives the sperm its energy. And then the tail is a flagellum. The beating whip-like movements propel the sperm forward. The head of it also has, you'll see this acrosome, that's a cap on the head of the sperm. That's got some enzymes that help the sperm penetrate the egg during fertilization. So I already talked about this. About 65% of the volume of semen comes from the seminal vesicles. I think actually I said 60 earlier, 60 to 65. 30% comes from the prostate gland, and then 5% comes from the bulbourethral gland. Semen is a whitish fluid. It contains both sperm and the fluid secretions of these glands. each ejaculation produces about between 2 and 5 mLs of semen, so less than 1 teaspoon. But that less than 1 teaspoon contains between 40 and 100 million sperm. Immediately after ejaculation, the semen becomes sticky, becomes jelly-like, and that promotes fertilization by allowing the semen to stick to the walls of the vagina and the cervix instead of immediately draining out. The alkaline nature of semen counteracts the acidity of the vagina, and that's important because sperm become immobile in an acidic environment. So the male sexual response starts with excitement or arousal. It plateaus and then results in an orgasm, and then the resolution is kind of like a refractory period where things return back to normal. And now the female reproductive system. The organs of the female reproductive system are housed within the abdominal cavity. If you want to get even more technical, probably the pelvic portion of the abdominal pelvic cavity. The primary reproductive organs, or the gonads, are the ovaries. The ovaries produce the ova, or the eggs, which are the female gametes. Then the accessory organs, the fallopian tubes, the uterus, the vagina, extend from near the ovary to outside of the body. The ovaries, there's 2 of them, one on each side of the body. They're about the size and shape of an almond. They sit on each side of the uterus. They produce eggs and some sex hormones. Each ovary contains thousands of immature eggs. During the menstrual cycle, the hormones cause one egg to begin to develop. It's enclosed inside a bubble-like follicle, and the egg stays in there and continues to develop until, at a certain point, the follicle bursts and releases the egg. This picture here shows the stages of a single egg in follicle development. The ovary does not contain eggs in multiple stages of development. It goes from start to finish once, and it's usually only 1 egg. Though I think sometimes it's 2. I think that's where twins come from. So internally, for women, the fallopian tubes are about 4 inches long. They extend from the ovary to the uterus. There's a narrow isthmus, and it's spelled I-S-T-H-M-U-S. That's the portion closest to the uterus, right here. The middle portion, called the ampulla, right, oh, here we got it over here on this side. Right here, this middle portion, that's usually where fertilization happens. It's usually where the sperm meet up with the egg and fertilize the egg. Cilia lining the inside beat and help propel the egg toward the uterus. So remember cilia, they help to propel things along the surface. That's what they're doing there, is they're moving that egg towards the uterus. The distal end is the infundibulum right here, and it's distal because it's furthest away from its starting point at the uterus. The fallopian tube doesn't really attach directly to the ovary. There's finger-like projections called fimbriae that fan over the ovary, and you can see them right here. The uterus, that's a muscular chamber. It houses and nurtures a growing embryo. It sits between the urinary bladder and the rectum. It's held in place by a broad ligament. I don't think it shows it on this picture. It tilts forward over the bladder. The curved upper portion is the fundus. It's this part right here. The 2 upper corners connect with the fallopian tubes, and then the central region is called the body. That's this whole part right here. The inferior end, or the lower end of it, is the cervix, and a passageway through the cervix called the cervical canal links the uterus to the vagina. Glands within the cervical canal secrete thick mucus that during ovulation, that mucus thins to allow sperm to pass through. The vagina is a muscular tube. It's about 3 inches long. That's a receptacle for the penis and the sperm. It's also a route for the discharge of menstrual blood, and it's the passageway for the birth of the baby. The smooth muscle walls of the vagina can expand a lot, like during childbirth, if you think about it, and the vagina extends slightly beyond the cervix, creating pockets called fornices. These are them right there. The external genitalia of a female, the mons pubis, is the mound of hair-covered adipose tissue. Remember, adipose means fatty tissue that overlies the symphysis pubis. The labia majora are thick folds of skin and adipose tissue. Hair grows on the lateral surfaces while the inner surfaces are hairless. The labia minora are two thinner, hairless folds of skin just inside the labia majora. And then the area inside the labia is called the vestibule. That contains the urethral and vaginal openings. The labia minora meet to form a hooded tissue called the prepuce over the clitoris. And the clitoris is a small mound of erectile tissue. It kind of resembles a penis. Its role is really strictly sensory. It provides a source of sexual stimulation. There's a pair of mucus glands called the lesser vestibular glands that open into the vestibule near the urinary meatus, and these provide some lubrication. And then there's two pea-sized glands called greater vestibular glands, also known as Bartholin's glands. They sit on either side of the vaginal opening, so one on each side. Their secretions help keep the vulva moist, and they provide lubrication during intercourse. The breasts in female are also part of the female reproductive system. Each breast contains between 15 and 20 lobules that are separated by fibrous tissue and adipose tissue, or fatty tissue. Each lobule consists of clusters of tiny sac-like acini that secrete milk during lactation. There are minute ducts that drain the acini that merge to form larger ducts. The ducts unite to form a single lactiferous duct for each lobe. And before reaching the nipple, the ducts enlarge slightly to form lactiferous sinuses. Each duct ends in a tiny opening on the surface of the areola. The areola is a pigmented area that encircles the nipple. There's a lot of sebaceous glands that dot the surface. Sebum from these glands lubricates the areola, which helps to prevent dryness and cracking during nursing. There are suppensatory ligaments that help support the breast and also serve to attach the breast to the underlying pectoralis muscles. So the female reproductive cycle, it averages about 28 days in length. However, the length of the cycle can range from 20 to 45. There's two parts of the female reproductive cycle, the ovarian and the menstrual. The ovarian, just like the name implies, centers on changes in the ovaries, and the menstrual cycle focuses on changes in the uterus. Both of these cycles are controlled by the secretion of hormones. The ovarian cycle is controlled by the follicle-stimulating hormone and luteinizing hormone, and the menstrual cycle is under the influence of estrogen and progesterone. So the ovarian cycle, because of course, why would we make things simple? There's 3 phases to it. Low levels of estrogen and progesterone stimulate the hypothalamus to release the gonadotropin-releasing hormone, which then stimulates the anterior pituitary to release FSH and LH. FSH, follicle-stimulating hormone. That triggers several of the follicles to resume development, beginning the follicular phase. Only one follicle is going to make it to maturity. Remember, only one egg matures each month. The developing follicle secretes estrogen, which stimulates the thickening of the endometrium in the menstrual cycle, and small amounts of progesterone. The follicle migrates to the surface of the ovary, and the mature follicle is called the Graafian follicle. In the midpoint of this cycle, the estrogen levels peak, which triggers a spike in the luteinizing hormone, or LH. This sudden spike in the LH causes the follicle to rupture and release the ovum, so now we're into ovulation. The fimbriae of the fallopian tube sweep across the top of the ovary to catch the emerging oocyte, or the emerging egg. The remnants of the follicle remain on the ovary and form the corpus luteum, which marks the beginning of the luteal phase. This corpus luteum secretes large amounts of progesterone and small amounts of estrogen. The progesterone causes the endometrium to continue to thicken and become more vascular because it's preparing for a fertilized egg to be implanted. High levels of progesterone and estrogen also inhibit the pituitary from producing more FSH and LH, so no other follicles will develop. If fertilization does not occur, the corpus luteum degenerates into inactive scar tissue called corpus albicans. Estrogen and progesterone levels plummet, causes the endometrium to slough off, which results in menstruation. With the decline in ovarian hormones, the pituitary is no longer inhibited, FSH levels begin to rise, and a new cycle begins. The menstrual cycle has even more phases, and some of them go hand in hand with the ovarian cycle. Estrogen and progesterone drive the menstrual cycle. So the menstrual phase is the first day of bleeding. That's considered the first day of the menstrual cycle. For most women, it lasts about 3 to 5 days as the endometrium sheds its layer, that layer that had been prepared for a fertilized egg that never arrived. The proliferative phase starts at about day 6. Estrogen levels rise. Remember, these are secreted by the ovaries, which stimulate the repair of the base layer as well as the growth of some blood vessels. And then ovulation occurs. The ovulation part of the ovarian cycle occurs. And then the secretory phase begins. The endometrium develops into a nutritious bed that's about 5 to 6 millimeters thick. Premenstrual phase, if fertilization does not occur, the corpus luteum, remember that from the ovarian cycle, atrophies or disintegrates, and then progesterone levels plummet. Blood vessels nourishing the endometrium spasm, which interrupt the blood flow. The endometrium then becomes ischemic and necrotic and causing it to slough off, and that is what produces the menstruation again. So the female sexual response starts with excitement, blood flow to genitals increase, the breasts swell, the nipples become erect, the greater vestibular glands produce secretions, the uterus stands more erect. On the plateau, the outer third of the vagina swells and the clitoris becomes highly sensitive. Orgasms, the muscles in the outer third of the vagina contract rapidly in series of pulses and muscles in uterus muscles in the uterus contract. And then resolution, the clitoris and the nipples soften, the vagina and the genitals return to normal, and the uterus drops forward to its usual position. That kind of sums up. I think there was nothing in there about the layers of the uterus and the endometrium and myometrium. It should be in the summary that I did for you. You do need to know the different layers of the uterus. Hopefully it's in there. If not, I'll make sure I add it in. It is in there. I'm looking at the summary now. So you do need to know the perimetrium is the outer serous membrane. The myometrium is a thick middle layer. It's smooth muscle. That's what contracts during childbirth. And then the endometrium is the inner layer. That's where the egg implants, the embryo develops. And the upper 2/3 of it slough off during menstruation. And that is it.